short period of time, it was kind of the operative term. You know, we went knowing that we wouldn't be able to follow, you know, women from, you know, to term through their pregnancies. So we really just had to kind of cross our fingers that we would find some women that were willing to share those moments with us. And that, I mean, filming the C-section has to be the kind of, I mean, one of the most amazing things I've ever seen, and the just incredible generosity of all the people involved in that, sharing that moment with us. It's obviously a very intimate thing, and it's amazing to see from a Western standpoint. Like, you're used to these kind of, you know, customized maternity suites and everything, and, you know, everybody having lots of resources surrounding that. And when, you know, a woman has to go into a cinder block building and you know, basically be cut in half, you know, to have a child taken out of her, it's a pretty, like, arresting moment in life. And I mean, the stuff that I cut out of that is like bananas. But yeah, I mean, it was amazing to see, and it's amazing to see. I mean, that's a woman that makes $2 a day if she's, you know, had a really successful day, and she's been enabled to, you know, have a completely competent medical team take her through the birth of her son, and that was a pretty wonderful thing to see.
Beautiful. Well, I'm going to just ask one more question to three health experts, and you're welcome to chime in too, Ben. But then we'll open it up to the floor for everyone to ask questions. But where do you see public health and global health going in the next 20 years? What trends do you see today, especially Mahad being a technology design company and, you know, innovating at the edges?
Well, I mean, I'll speak from sort of my perspective on the technology. I'll stay away from the other stuff. You know, I always talk about healthcare being this incredibly information-intensive practice. We don't think of it that way, but it is. A lot of it's really about moving information from, you know, us as patients, you know, through the medical system, and, you know, finding solutions to our, you know, what is ailing us. And sometimes that's a simple process, and sometimes it's a complex process. And it happens throughout our lives. And sort of this process has existed from, you know, basically since humans existed. You know, now we have layered onto it the incredible power of information and communication technologies, which allow us to process information in new ways, cheaper, faster, all over the world. And I see that is really what's going to be happening to the field of healthcare in the next 5 years from the technology perspective. Is how do we manage this information, and how do we use it to do things like do more efficient healthcare, reduce errors, make a more personalized visit to the health system, make it more friendly, you know, depending on what you're talking about. I'm talking about broadly here, I'm not talking about necessarily the developing world, I'm talking about all over. And so I think from that perspective, you know, my very small perspective within global health, that's what I would say.
What about you?
As a practicing physician,